time mental health is being seen as an issue that is not affecting everyone. It's seen as an elitist issue, but now we've come to a point where we know that especially for young people, mental health affects them, and we need to have strategies and more money invested in it in order to make it better.
So for this, we are happy to join this event because we've been partnering with the Nairobi Metropolitan Services through the Health Department. We supported in the establishment of the Gaira Friendly safe space for the children. One of our key priority areas is also health, and mental health is one of them that we focus on the children and also the families and the community at large.
Among people who are 10 to 17 years, death by suicide is becoming a big challenge. Nairobi in itself has a big challenge because of the structure of the communities.
I think as Nairobi County, we are looking at making mental health a priority for Nairobi. Why? Number one, we have a very high population. Of which population, this population of about 6 million, 22% are living in the informal settlement in poverty. So when you look at it, they have very high mental health needs. You look about the needs in terms of the low socioeconomic status, in terms of unemployment, drug and substance abuse, exposure to violence. So you find this is a population that we really need to have strategies that are responsive to these needs.
I think the first thing is to look at how we can eradicate stigma, because there's a lot of stigma around mental health in the African communities. So we need to have safe spaces for people to tell their stories without feeling stigmatized. And I also feel like governments need to invest a lot in funding on mental health, because there is little funding around mental health. And of course, we need to have holistic approaches to mental health. We need to look at ways in which people can maintain their mental health through, nutrition, exercise, medication, yoga, meditation, journaling. We need to really have options where people can know which one works for them.
Knowing that we're only beginning to talk about it, Manisha, clearly there's so much that has not been done, and we are only beginning to talk about it, meaning the work is yet to really be done. So I think we are in a not so nice place, but at least we're somewhere where we're beginning to have these conversations and people are beginning to be more receptive and appreciative of and open to speak about such conversations, which previously ingekuwa abomination. Yeah.
If you have any mental health problem, there is help for you. Number two, that we can do things as a whole in Nairobi inclusively to reduce or to eliminate the stigma that we put on people who are going through mental health problems. And number three, which is most importantly, that the government has put up mechanisms within the healthcare system for you to be helped.
Advocacy opens doors to a lot of things. We need to advocate for the urgency of mental health being seen as a national issue. Once that happens, then you see people like legislators and county governments will see how important mental health is and how it's affecting our people. And then from there, we'll be able to debate whether or not to increase more budgets in order to have solutions such as more openings for counseling, more openings for strategic programs, for capacity building, for people to understand, because one of the biggest issues is that people don't understand what mental health is. Those who have it, people think that, our African culture, they feel like, oh, maybe you're crazy or this and that. But mental health has two angles. There's the mental wellness aspect and the mental illness aspect. So the mental illness, such as schizophrenia, depression, anxiety, panic, then mental wellness is really just the readiness and preparedness of your mind and harnessing your emotional intelligence whenever you're in different places. So one of the things is that we have to really make sure that our legislators and our counties understand that there is an urgency to it. Then we should also partner with different developing partners, different parastatals and government platforms in order for them to create subdivisions of mental health solutions in order for us to grow and in order for us to harness and also just focus on specific groups and specific targets to make life better.
We have our Emergency Operations Center with 1508, and this 1508 you can call it and say where you are. And what is important is that you are given direction to a health facility where you can go and help somebody. In fact, we ourselves are looking forward to people who have what we call lived experiences, so that then they can be peer mentors to other youth who are in those challenges, who are going through those problems, so they can educate them. Because as healthcare workers, we are knowledgeable and we are trained on the expertise. But sometimes it is important to have somebody who has had the lived experiences to also shine a spotlight, either on the blind spaces in the healthcare or in the community, or for the people who really need that help.
Seeing persons with disabilities being included in this event was an awesome thing, and also seeing children.
Nimebambika kucheza ball, vitu kama hiyo, kujuana na watu wengine wenye tulikuwa tunajuana kama tu hivi.
Leo imekuwa poa juu ya watu wamejibamba, tumejuana na watu wengine, na pia kuna wengine kwa manyumba zao hawapati chakula, lakini afadhali leo wamekula kiasi.
The highlight has basically been listening to other partners and what strides they have taken in order to ensure that mental health is included and incorporated and advocated for more.
It's nice that, you know, younger people are beginning to have these conversations and be very open about it, and also have fun, like ujipake marangi na pia you talk about things that otherwise zingekuwa like an abomination or something you don't want to say. Yeah.
For me, the highlight is seeing the youth in this. Taking, you know, we have the youth 13 to 29 years. They have the highest population. These are the most affected by mental illness. Suicide is the second leading, and depression among this population. So when we have them here, when as the experts are there, the leaders are there, and the youth are holding this as their priority, I think for me is the highlight.
I think my message to all the youth is, it's okay not to be okay. You will never know someone is going through any mental health challenges or any mental illness. Try to find people, a safe space, a safe circle for people to help you. You talk to them, open up, journal, do what makes you happy, do what makes you sane, and make sure you advocate for yourself to be your first priority.
Your mental health is everything. Your mental health is everything. Whatever ambition you ever have in life, whether it is in sports, whether it is in politics, whether it is in career, your mental health is everything. So guard it very jealously.